All right, we'll go ahead and get started. Good afternoon, everybody. We're happy you're here and welcome to What's New with AvaSure. This is our quarterly update meeting where we share the latest enhancements to our virtual care platform and spotlight new ways that we're supporting our customers. We're excited to have you with us and cannot wait to show you what's new. My name is Nicole Douglas. I am a marketing manager here at AvaSure, and I'm really excited to introduce this webinar to you all today. Next slide, please. So today, what you're going to hear, we're going to show you new ways to use your AvaSure platform to support virtual care across your hospital, whether that's in the ED, in MedSurg, or even at home. AvaSure can support you. We're going to cover how AvaSure integrates with your other systems in your tech stack, like smart TVs, nurse call, care communication tools, and even more. You're also going to get a look at the latest updates to AvaSure's analytics tools, plus a quick reminder about the wide range of resources available to you all as AvaSure customers. Now, I'd like to introduce our speakers on the next slide, please. First up, we have Bree Laughlin. Bree is a really bold innovator in healthcare, and we're so lucky to have her here at AvaSure. She began her career at the bedside in both kidney and liver transplant before she rose to become a nurse executive at Epic, one of the largest healthcare software companies in the world. In 2020, Bree went on her own and she founded Nurse Disrupted to solve a critical gap. No one was delivering and designing software with nurses and frontline workers at the center. So her company's bold vision and real-world impact led to its acquisition by AvaSure in 2025. So today, Bree serves as the Executive Director of Virtual Care Innovation at AvaSure, where she continues her mission to build the next era of care, one that is clinically led, tech-enabled, and human-centered. Next up, we have Erin Griffiths. Erin is a customer success manager here at AvaSure with a really strong foundation in emergency nursing and rural hospital leadership. Hey, Erin. Erin is a mastered prepared nurse and a former director of nursing. She brings deep clinical insight to her work, helping hospitals create safer care environments. She's lean certified and has a strong focus on process improvement. She's always looking for ways to make care delivery safer and more efficient. Today at AvaSure, Erin helps hospitals create those really safe environments through virtual care. She works side by side with our customers to drive and measure impact where it matters the most. All right, ladies, I know you have a ton of things you're excited to share with our customers. So Bree, I'm going to pass it off to you to get us started.
Thank you so much, Nicole, and hello, everyone. I'm so glad that you've joined us today, and I feel really honored to be able to walk through this quarter's edition of What's New with AvaSure. We'll go ahead to the next slide. Now, I like this slide a lot because it shows truly today what common virtual care strategies are. It is across the continuum of care. I mean, we are far beyond the walls of acute care, although virtual care is taking place throughout our acute care hospitals. But I like the picture on the left. We have our outpatient centers. I like the picture on the right. Care is happening in the patient's home. I love interactive webinars myself, and I wonder what your opinion is on the next frontier of virtual care. I'd love to hear your chats. For me, I'm hard pressed to think of where virtual care will not be important moving forward, but where do you think the next move will be? Now we're going to walk through a patient's journey. So we can go to the next slide. I love to tell stories, something about me, fun fact. But as we get to unveil what's new with AvaSure, we're going to walk through a patient's journey. And you're seeing Frank here, our patient. He's a 46-year-old man whose wife became a little bit concerned at home. She noticed that he had a little bit of a facial droop, that he was slurring a little bit, and had lost his balance. Now, I'm from Madison, Wisconsin. That's where I am today. And Frank and his wife live up north. And if you know anything about that, it's a very rural state. Now, if Frank had to drive to Madison, it would take him 60 minutes. And with symptoms like this, time is of the essence. But the wonderful news is that his rural hospital uses the AvaSure platform. So it's only a 5-minute drive when time is of the essence for Frank to get into his local emergency department. Now, something I'm proud about at AvaSure is that there's not a one-size-fits-all technology depending on the space and the care area and the workflow that you have. But Frank's local hospital uses a mobile device that works really well in the emergency department for their telestroke program. Next slide. Now I'm going to play a couple of care provider roles, and now I'd like to play the role of a neurologist. So I'm a neurologist now working in Madison, Wisconsin, but what's great is I can support our telestroke program across our hospitals that are in different locations across the state. Now, of course, as a clinician, I'm living in my EHR. That is where my schedule is. That is where I'm managing my time. And what we're seeing here is as I'm looking at my EHR, I have a new patient that's come up on my list to be seen in our telestroke program. I review his chart, and then I'll draw your attention to the camera that you can see in the chart. Now, to me as a neurologist, it is one single seamless experience, thanks to AvaSure's Epic integration or EHR integration. And the integration happens where my work happens. In this case, it's happening in Frank's chart, but be it a patient list, a schedule, monitor, we're able to ensure that you do have seamless workflows. From here, after reviewing Frank's chart, I launch the camera. I'm able to use AvaSure's sophisticated tools to zoom in. You can see the controls there. I can invite my teammates. Ooh, we're not quite ready to advance. I can invite my teammates in through the, the group conferencing schedule. And I'm also able to leverage the power of my chart. So I'm able to actually dock the video, share my screen, work with Frank as I'm completing this assessment. Next slide. It is so important that as I'm providing virtual care, that I can do the assessments that I can do in person. And in this case, I'm using the camera zoom to look at Frank's face, to look at his pupils, make sure they're regular. And in this case, actually, the camera serves me better. I wear reading glasses, Erin. I know you're talking about this too, but the technology is actually helping me get a really good assessment of how Frank is doing. The other thing that I think is pretty cool and something that's coming that I forgot to message is coming soon for our mobile devices is actually a battery pack. So we have a little bit more flexibility in where those devices are, and wherever the device is in the room, the powerful zoom is assisting me to make sure that I get the views that I need. I do want to go back to that Epic integration really quickly. Maura, can you bring the slide back? Something that I'm not sure if everyone knows with the EHR integration. I mean, so many of us are clinicians. You know, it is important for us to have that single unified space. But I think that it is exciting to know that we are working with Epic on the Epic Toolbox work. And what that means is, although you can ask your customer success representative to talk to you a little bit more about our EHR and specifically Epic integrations, but it means that not only is the capability available, but we are looking at the rigorous requirements in Toolbox. And then also, I'm just going to let you know, we're going to be at UGM. So if you're going to be there, I'd love to see you. Just reach out to us and let's make sure that we're connecting and working on those integration strategies together. Maura, thank you. Go ahead and advance 2 slides from here, if that's okay. Here we go. So test results come back from Frank. Good news, he has not had a stroke. However, there are a couple of things that are concerning, and so we are going to admit him into the hospital. Now, I'm also worried about his stability on his feet, and so I'm going to enroll him into the monitoring or the observation program. So now we have a view of a virtual safety attendant who's going to make sure that Frank is monitored and that he's safe. A couple of things that I would like to point out is that coming soon will be the ability to monitor even more patients than what you have today. Also, we have been working very hard on AI that helps us. Now, I think as a nurse, that I have a passion for tools that are of high quality, high safety, that are created by clinicians and that help lift my workload. And so I'll draw your attention to the center of the screen where you do see an alert with a patient who has their feet out of the bed. Now that's very helpful to me because I'm monitoring the patients, but we do have those notifications coming up saying, hey, Bree, I think you want to pay attention to this patient over here. Their feet are out of the bed. So I'm really excited about the work that we've been doing to assist our wonderful care providers in making sure that our patients are safe and taken care of. We can go to the next slide. Now, as a charge nurse, and I know a lot of charge nurses are also taking on some workloads. As a charge nurse, we are having to coordinate a lot. We're supporting our staff. We're trying to make sure that the right things are happening at the right time. And so I'm excited to show you a virtual care assistant that is made and designed to help lift workload and direct it into the right areas. So you're seeing Vicky, a virtual assistant on the left side. This is in collaboration with NVIDIA. The way that Vicky helps lift some of our workload is that Peter wanted some ice chips. And instead of having to hit his call light and have our staff walk into the room, he simply said, hey, Vicky, I'd like some ice chips. Now, what I appreciate about this dashboard is I'm going to walk through a couple of things. There are the patients, but a request is not a request is not a request. There's some sense of, ice chips are a lower priority. This is not, an all hands on deck thing. But if a patient complains about something like a stomach ache or a headache, that's going to pop up on the priority list, and I'll know that I want to walk in there, or I want to have the nurse walk in there and evaluate the situation. So a lot of help here with the dashboard that's navigating some of the requests that are coming in through our virtual assistant, Vicky. And of course, that works with the care providers as well. If I'm in the room and I'm passing medications, I can say, hey, Vicky, we need a pillow in here. And that can help engage my CNA to get a pillow for my patient. Okay, next slide. Fast forward in time. Frank is ready to go home. We're going to discharge him to the hospital at home program, but Frank is relaxing in his room. He has his infotainment TV here. He loves to watch Jeopardy, so he chooses to go to his show. And then he hears a doorbell, and he hears a nurse saying, Frank, is now a good time? I have discharged orders for you, and I'd love to get you home. A couple of things I'd love you to notice about this screen is that it integrates really well with other systems. So what you're seeing, a lot of people are using the whiteboards, the Epic TV is emerging, other IPCs are emerging, and we've done a lot of work to integrate well with the solutions that you have today. And we have partners also that we've done work with to make sure that the patient experience with their entertainment and with the other technologies that you're using work very seamlessly with the virtual care experience that's provided by the AvaSure platform. Now, in this case, in the center, you see your virtual caregiver would like to establish a video connection with you. And Frank, so now I'm playing the role of nurse. Frank can hear my voice and me asking permission to enter the room visually and complete his discharge instructions. And with that, we can go to the next slide. He says, yep, that sounds great. He'd love to get home. And this is the way the video looks as Frank has my undivided attention as a nurse completing his discharge with the video connection. And the same as what we went through with the neurologist. As a nurse, as I'm going through those detailed discharge instructions, I can share the patient information guides. I can actually conference in his wife to make sure that she's getting all of the discharge instructions as well. But this is simply the patient view as we're completing the very detailed discharge instructions. And what we keep hearing is that the nurses who are providing this care are providing the level of care that they want to, that they're able to provide a thorough discharge when they're practicing virtually, because they're not pulled with, alarms and passing medications. I'm working with my at the bedside teammates, but really able to give Frank the detailed discharge care that he needs. And we can move to the next slide. Now, when that visit is done, and we can go back one, when that visit is done, what's nice is the TV goes back to the show that Frank was watching. So we here at AvaSure think a lot about integration. You've seen it with the EHR, here with the infotainment system. We're going to talk a little bit about an open API for partners, but we know how important it is for not only providers to have a very seamless experience, but also for our patients. So Frank doesn't have to find his remote control again. It simply returns his TV to the screen that it was on prior to the virtual care provider entering, his quotes, entering the room. Okay, thank you. We can move to the next slide now. Now, Frank has qualified for a hospital at home program. So he still needs quite a bit of care from the providers, but it's all care that can be provided with a virtual experience and a single home visit with the home health nurse. AvaSure has released a hospital at home platform that will work on Frank's tablet. So he is able to heal at home and still engage with his care providers from the comfort there. So really excited about that journey. Okay, go ahead, next slide. We're coming back to where we started. So AvaSure is we've been focusing on an intelligent, integrated enterprise ecosystem that works seamlessly together in providing solutions that work in every space, yes, within the hospital, but beyond the four walls. That we are extremely cognizant of the tech stack that you're working with, the different technology solutions, and that we're able to integrate and consolidate and create a seamless experience throughout the care continuum. I'm going to pause. I don't know if there's been questions or thoughts that we want to address now before we move on.
I haven't seen any questions come in, Bree, so you can keep on rolling.
Okay, we will go to the next slide. So on the next slide, we will see something that I am really excited about. So as Executive Director of Virtual Care Innovation, I love to push forward our innovative vision, and something that we're working on now is an AvaSure Innovation Lab. Okay, what is an AvaSure Innovation Lab? This is a partnership with select health systems where we can deploy a simulation lab or an innovation lab on your facility. And we can work on the next level of initiatives that you have with virtual care. Again, this is something that's an early stage, but the design will be that there is a platform for a simulation lab, that we work with you on workflow development. So for instance, there's been interest with detecting workforce violence. So we've done some early work on trying to develop meaningful AI on workforce violence detection. This particular customer is really interested in working together on that model. And in this lab environment, it would be a collaboration on saying, what should the workflow be? How do we mature that model? The third tile here, you see an integrated environment. So if, in a contained environment, we want to say, okay, one of my favorite emerging technologies is touchless vital signs. There are a lot of vendors that are out there that are doing vital audios, a great one, but that using our computer vision and the audio and video feed, that the technology is starting to become more mature, that you can get vital signs without having your attached devices. That's just an example of how we can use the open API for partners in an innovation lab to test out and work on workflows. I know a lot of people are excited also about ambient listening and documentation. And it's a great space for us to, work on the integrations and hammer out some of these newer technologies in an innovation lab. It is a two-way collaboration. So if you are interested in this type of partnership, we would be learning together and also looking to you to be a flagship and reference site. So in early development, something that I'm spearheading, if you are interested in it, reach out to customer success or let us know now, and we'll continue the conversation as we continue to work on this. And with that, I think we can go to the next slide. And I would love to pass the mic to my friend Erin. I'll let you take it away.
Thank you so much, Bree. I think my picture will come up here in a second. My name is Erin Griffiths. I am one of the customer success managers that works with certain teams. I have a couple, and I'm happy to join you today and tell you a little bit about what we do. We're going to start actually with a poll. So I'm going to give a moment for that. How often are you using AvaSure Analytics on a regular basis? So we're going to give just a moment to answer this, and then I'll share some of that with you. Okay, looks like that poll has ended. And so we have about 43% use it every day, of course. 14% use it once a week, and we didn't have any respondents on once a month. We love that feedback because it just gives us a gauge for things that we could do to maybe, add new graphs, entice you to, help us share your good ideas with us to build out what it is you would like to see. We love feedback, and we encourage you to tell us what might be helpful for you. So, all right, next slide. So one of the things that we do in customer success is we meet pretty regularly with our customers, and we discuss the progress of your program. We hope to make that program as robust as you want it to be, and show you the success that you're having with that program and build it into perhaps virtual care and beyond. So that being said, I would love to show you what is new in our analytics platform. And what is new is each one of our tabs, so demographics, utilization, etc., they all now have a very high level dashboard. And that dashboard tells you just your information. This one in particular is in demographics. So what portion of your patients are you watching for falls? What portion of your patients are being discharged out of the hospital? Generally, we do see quite a high number of the patients monitored for falls, but there are many other reasons, and we work with you, to be able to just kind of understand what these are saying. If we have a high number of other in either of these categories, we start to dig in with you to just determine why might there be so many in other. Is there something with the process that's confusing to the monitor techs or the floor staff? and how can we combat that. You can see across the top of this bar, there are many headers where you can do a little deeper dive, and we do that alongside of you to just make sure that you can build your program out the way that you would like, and hopefully see it come to fruition the way that you would like it to. Next slide. All right, this one is an exciting one that many people have really reacted to in a very positive light. This is a new graph that allows us to be able to see how many devices are we using by day. You can see that they give you a few months worth of data, but then you can take that data and you can actually break it apart by week and by day of week. Be able to see what is my highest utilization, what is my average utilization, and what is my lowest utilization. Sometimes when we would look in utilization before, people would say to me as customers, boy, I thought we were using it more than that. Now we've given you the ability to really do a deep dive and be able to see right in the moment or right in the last few days how you have been using that. So this is really quite a nice tool for sites. As well, you can dig down into some of that other daily information, and that was really based on an idea that customers came up with. We would love to dig a little deeper and be able to see our utilization rather than month over month, day by day. So this graph and this group of graphs is built for that. All right, next slide. Thank you. So this one here, Events Prevented, is a very nice dashboard that allows you to be able to see not only what's happening in your site, but also drive down by unit what is happening. The second tab in there is actually called by avoidance type. And what I really like about that one is you can give some direct feedback to your monitor techs about the things that they have documented on and the things that they have prevented over the course of whatever time period you pull up. All of our graphs now go back to 1/1 of 2023, which is very handy. If you were somebody who lived in the world of Orna previously, you can utilize this platform. There's only a few that are gauged for a smaller time period, and that's just for bandwidth. We want to be very careful and make sure everyone can access it. So you can drill down and be able to give them feedback over the past quarter, over the past half a year, over the past year. And we have a lot of sites that are utilizing that to be able to pick like a tech of the quarter, or just highlight those best practice individuals that they would like to see kind of be the example for others. And they pair this along with a verbal to prompt ratio graph that we have under staff interventions to be able to give them some feedback on that as well. We really like to highlight that we really encourage a verbal percent of 70% to the automated prompts a percentage of 30%, because we know that those verbal prompts really help to decrease falls overall. Next slide. The stat alarm response time, there's actually a group of 3 new graphs that are available to you. There is also an adverse event that is very much like the events prevented, but it actually shows then the opposite of what has been recorded as happening. And for many sites, these 3 are just really nice to share overall and show your upper leadership, middle management, boots on the ground. Overall, how have you been doing? So we have stat alarm response time that will show you kind of a longer time period, and you can set that for smaller if you want. If you only want to share a quarter. And then as well, it will show you verbal response and then pre-recorded announcements, and be able to do some work within that. But this one in particular I like because you can give some kudos to your staff and say, AvaSure recommends anything under 19.2. I will share a call out for my VA sites that if you have CLCs, that doesn't exactly apply. The geography and the staffing is different. And I think I've talked individually with all of you, and I'm happy to if you want to ask more about that. But for the average private hospital, 19.2 in an acute care setting is absolutely an acceptable time. And you can see for this site, They've done very well. So this might be something that I would share and just give some feedback to the staff on the floor to say, boy, you're doing a great job and you're keeping patients safe. Next slide. I would like to highlight some other things that we do when we meet with you. We do review technical issues. We want to make sure that everything is running smoothly and that you don't have any issues. We have a wonderful customer care team that can take care of those things. We make sure that your software is up to date. We like to have our customers on the latest versions, and so we might bring that to your attention. And as well, maybe some contract renewals if the time is coming up for those. We like to warn you early so that it's not as much hasty work, but kind of a smooth cadence. And then the best thing that I love to do personally, clinically, I love to share best practice. I love to share resources with you. And two of them that I've highlighted here that are very important is our virtual education. Our education department offers free virtual classes that are live education every other month. We've included the link, but should you not access that link now, it is always on our website. But it will show you not only a glossary of the classes that are available to you, but it will show you who might want to attend them. We don't ever turn anyone down. You're welcome to attend them all if you would like. However, it will tell you who might be interested in them and then allow you to register right from that site. I might call out one that is called the Advanced Video Monitor Tech class. Comes with a wonderful completion certificate that could be possibly turned in for a competency. So if that meets with your requirements, we've already done that work for you. So the other one that we have is we have enlisted for our customers a digital resource library. So we can build resources into a platform that you can access. I did not include a link because it is different for every site. And so your customer success team can certainly put some links in there for you so that you have those documents. But we do have many resources, white papers, things we love to share, tip sheets, and we are happy to talk about that when we meet with you. And with that, I'm going to pass it on to Nicole. Thank you for your time.
Really appreciate it, Erin. Thank you.
Mm-hmm.
All right, so I'm going to give one last call for questions. I have a few rolling into the chat, so while I give you all a moment to ask some questions, I did want to make sure that you're aware of some upcoming events. So next month, we do have our next webinar, and that's going to focus on how virtual observation can help to combat workplace violence. You all have been asking for this a lot, and we're really happy to share stories about how customers are usually using virtual care to protect their staff. Now more than ever, this is something that we want to make sure our customers are aware that they can use their platforms to support. We're also really excited because we are going to be exhibiting at Epic UGM this year. So we're very proud to be a part of Epic's Toolbox program and excited to share more with our customers at Epic's user group meeting. So if you or someone in your leadership is planning to attend, please go ahead and reach out to your AvaSure account representative, and we'd love to connect with you there. Also, last but not least, don't forget this September we are bringing AvaSure's biggest event back, our annual customer symposium. This year we are heading to Charlotte, and it's shaping up really to be the best one yet. You can expect some inspiring keynotes and real-world success stories about how hospitals are using AvaSure's platform to support their virtual nursing programs. And of course, we're going to have a lot of fun along the way. If you haven't registered yet, you can do so at AvaSure's website, so you can go ahead and head there now. Next slide, please. So if you are looking for ways to continue to stay updated with AvaSure, it's as simple as signing up for our monthly newsletter. So there is a QR code on this slide. You can also visit the URL there if you'd like to make sure that you're getting these updates regularly. All right, so I think we've got a few more questions in here. So I'll go ahead and bring our presenters back up here, Erin and Bree, if you'd want to join me back. So we've got some deeper questions really about the platform and ways that you can use it to support your staff. Bree, this first question's for you. So you had mentioned integrations throughout your presentation. So I know we're very excited about the amount of investment we've made in integration. So would you mind just telling the audience again kind of what investments we've made to keep our platform open and interoperable, and what types of integrations AvaSure offers, and which ones you would recommend that our customers are really prioritizing?
Yeah, Absolutely. So there's a few main spins on the vast work that we've done on integrations. And I go back to, I was at a conference, THMA, with some of my friends who are CNIOs, and one of them was like, Bree, look at my look at my phone, and the appointments and the messages that she had been receiving were endless. I don't know, maybe like 200 for the day. And what is a testimony to is how much technology is part of healthcare. And the amount of technology is accelerating. And how do we be that strategic partner that helps to consolidate the weight of competing tech stacks, that we can say, okay, you really do need an integrator for, especially, the virtual care strategy is us. But how do we make that a lighter lift for our partners? Now, first and foremost, we are fully aware that people must live, that clinicians must live in their EHRs, that this is the space that, it's how billing happens. It's the certified, documentation system you have to use. And so ensuring that wherever you're providing care, patient lists, schedule, monitor, that is where you're living, and that we really have done rigorous work to be able to launch our system seamlessly so that your care providers and people who are servicing the patients, that it really feels like one system. Then the cool next piece is that we've talked about, there's a third piece after this too. We know living in your EHR, you launch the system. We talk about an open API for partners. So it's not, my Uncle Ed who wants to try his hand at programming that can, plug into our system. It really is a partner agreement. But the cool thing is, for instance, as Suki and Abridge are maturing their ambient listening models, it doesn't have to be a crushing tech stack. It can be using our open API for partners to leverage some of those additional technologies that use our camera and our computer vision and the audio feeds. So we're really proud of that. And you don't know, with the acceleration of technology, you never know when you're going to wind up with an Abridge and say, yes, we do want to use that, or a Suki. So we've done the work so that we can take the lift for you in consolidating those tech stacks. Now, the third one is, we've been around a long time. We've been working on other partnerships. So for instance, with call systems and with staffing, we have staffing partners as well. So please do work with us on our list of vetted partnerships that we have to help, again, create that enterprise integrated ecosystem for your room. Did I miss anything, Nicole or Erin?
I think you nailed it, Bree.
Did I?
There's
Okay.
just an incredible amount of work that has gone into integrations over the past 2+ years. And so really excited to keep on making sure our customers are aware. So we have been partnering with a lot of the big names in each category. So if you do have questions about whether your system can integrate with existing vendors, just make sure you're talking to your account representatives, because chances are we do. So we're happy to share that with you. Thanks, Bree. Erin, next question's for you. There was a question that came in about, what is the feedback that bedside nurses are sharing regarding their experiences with inpatient virtual nursing models? How is that impacting outcomes and things like nursing satisfaction?
I think it really helps with nurse satisfaction. I believe we had a poll, and 97% of nurses said that they believed it alleviated some of their documentation. Not only that, it's saving them time in a day. I had a customer that I personally worked with along their virtual care journey, and as they added admissions to the discharges that they were doing, they estimated that they saved about 2 hours per nursing shift in a day. That's significant if you do your 12-hour shift, the work that's saved for you. Also, I believe that nurses are just on a whole satisfied with it because they think it's a pretty well holistic job, more so than being interrupted several times while you're doing that education, not really sure if somebody's getting it. In the virtual nursing, you're able to pull in maybe a family member that isn't able to be present. And so lots of things are positive drivers in that virtual nursing world. As well, other uses are being able to bring a specialist into a rural setting. So having those patients in those rural settings being able to have access to that care is a big satisfier, not only of the patient, but also of the nurse working, because they're able to provide that care and see their local, community not have to travel quite as far. There's been HCAP improvements in some of the sites that we have partnered with. Improved communication about medication, for sure. We always wonder, did they get all of it, right? And so just, I think the benefit to the nurses themselves, and then as well, of course, patients are always of utmost importance, but it is a huge nursing satisfier.
Thank you for sharing. And in addition to everything that you had mentioned, I mean, the list is long of ways that virtual nursing can help to impact hospitals and staff. And what I heard a lot at the recent ATA Nexus conference was the fact that it's improving retention rates. It is a way to keep staff. It's a way to offer flexibility in their roles, especially if they can do some days at the bedside, some days at the webside. So it's a really unique way to keep staff happy, keep resources at the bedside, and to offer some flexibility into how they're staffing their programs. So really excited to see across the board the way that nursing is really embracing these types of programs.
Mm-hmm.
All right, next question. Bree, I know you love talking cash money. So when we think about virtual care programs, the big question that our customers have, and as you're looking to implement new technologies, is what's the ROI? Can you talk a little bit more about really finding the value and the tangible value of these programs to really help usher these through?
Yeah, margins are real right now. I mean, they always have been, but now more than ever, hospital systems are operating at razor thin, if not negative margins. So there's the concept of soft ROI and hard ROI. And, as a nurse executive and nurse leader, always laser focused on quality and outcomes. The advice that I give, or big conversations, with friends of mine also is that you need to be best friends with your CFO. Bring them a coffee, bring them some chocolate, and sit down and talk about cash. Over the past 5 years, as virtual nursing was maturing, right? The pandemic hit, we had to figure something out. We knew it was going to be a virtual play in the inpatient setting, and people tried a lot of things. It is accepted now that the lowest hanging fruit in seeing a hard ROI, so a soft ROI, takes years to validate and may have a lot of competing initiatives. A very good example is retention. Over the years, the evidence base is becoming more convincing that offering nurses or clinicians in general virtual roles, especially if it's augmenting, bedside roles, increases retention. With the CFO spin, however, it often is, and we've done, 3 other major investments in staff retention, and the data is kind of a 2-year lead time. Hard ROI, 5 years later, it has been tried and true to look at throughput. There's already financial strategies on throughput for most hospital organizations, and money is being just, I hate to say thrown in the fire, but kind of is, in the way of emergency department boarding. So people who are in the emergency department who could be on a lower acuity unit like med-surg, right? It hits ratios, it hits capacity, it burns through a lot of money, and it's something where virtual care can loosen up the gridlock pretty quickly. The other metrics, and I was just talking to my friend from the Guthrie Clinic a few months ago, GMLOS, geometric length of stay, and then time from physician order to actual discharge. A lot of people are riding at that 3-hour mark with a target of trying to get down to 90 minutes, because again, each minute that passes by that the patient could, or that the bed could be hosting a patient from the emergency department or from the OR and PACU, is actually revenue that is lost by the hospital system. And quite frankly, people want to be home. They don't want to, I mean, how many times do we have the order and we're sitting here with the patient, the family, and they're like, okay, I'm ready, got all my stuff here, I'm ready to go. It really is a better patient experience. But that hard ROI, if you sit down and you talk to your CFO and ask, what are the metrics and benchmarks that you are targeting? Ask them tied to throughput. They're going to have some very attainable metrics for you in your first foray into virtual nursing. Largely admission and discharge. It's a nice kind of meat and potatoes play because there is that financial strategy already in place, most likely at your hospital system. And then it's also admission and discharge has become now a standard practice over the past 5 years. So you don't have to say, what's the model? Well, you practice in person or you practice virtually the way you would practice in person. So hard ROI. If you don't have a great relationship with your CFO, make one. Talk about what those targets are. There's going to be one tied to throughput that you can get with the first step in your program. Once you get that initial funding for your program, then you can expand to what we know we need: new grad support and dual nurse workflows and all that kind of fun stuff. But I think, in 2025, that's become the tried and true way to get finances moving through your organization and then fund your larger, more complex strategy.
Awesome. Thank you, Bree. And I think there's a great resource on AvaSure.com, having someone drop it in the chat here in a moment here, that does outline some of those metrics. There it is. Perfect. Thank you. That outlines some of those higher level metrics. So Bree is clearly passionate about the topic, and we've got some expertise in house. So if you ever are asking, what the right way is, what the right metrics are to look like, that we're here to help. And we've got people that have made the case before and been successful. So we're here to support you in making sure that your virtual care program's got those established metrics for success. All right, I think last question here. This came out of the webinar plug here. So Erin, little bit of a preview for next month's workplace violence webinar. This is something, as I mentioned, we're hearing across the board. Press Ganey recently announced that two nurses are assaulted each and every hour. I mean, this is something that nurses have been unfortunately facing for years now, but is finally getting the attention and investment that it deserves. So could you talk a little bit more about how virtual care can be used to help protect staff at the bedside?
Yeah, absolutely. So we know that previously many sites had not watched for low and moderate risk suicidal ideation. We do try to encourage our sites to do so because a lot of the times it is absolutely enough and lessens the burden and gets our techs back on the floor to be able to provide patient care, which is so very important. As well, I have encouraged some sites to go ahead and continue to monitor on our AvaSure devices while they have a one-on-one sitter with those high risk. And that is merely a move to make sure that your staff is safe. And a very respectful one. If I was a staff member, I would feel so good that my site did that. Just respectful of my safety. Sometimes it's the second set of eyes. Sometimes it's the only person that can reach out for help. We have been, if you're clinical, you have been in a situation that probably got away from you a little, and through no fault of your own, you find yourself in a little bit of a pickle. And wouldn't it be wonderful if somebody was there to be able to just, push the stat alarm, get you some help faster? And so we do encourage that, not necessarily high risk, only the device, certainly not, but in conjunction with, we would love to see that kind of expand so that we know that we're keeping both patients and staff safe.
Absolutely, thank you.
And our presenters for the webinar, I'm just going to give them a little plug. They are my customers. They are such smart gals. And they've really done a lot of work within their organization and have some really nice things to say. And just hope that you join us to learn. We can all learn from each other.
So thank you, Erin.
Mm-hmm.
All right, I think that's everything that I have for you both. So wanted to thank you both for your time. Thank you to everybody for joining. And if you do have any questions about anything that you've seen here, please feel free to reach out to your AvaSure account representative. All right, thank you, ladies. Everyone have a great rest of your day.